Lab control, may I help you? Do you confirm that you have a suspected Ebola patient? Hold on 1 second, please.
When receiving a notification that lab tests have been ordered on a suspected Ebola patient, be sure to remind the biocontainment worker they need to give the lab 1 hour notification before sending specimens.
And I would like to let you know that we need about an hour notice before you send any specimen to the lab control for Ebola. And also, I'd like to tell you that a blood gas is stable for only 30 minutes.
Lab personnel should fill out the lab prep form for a suspected Ebola patient located in the Ebola binder and inquire if they will also be ordering blood gas tests. Be sure to inform the caller that a blood gas specimen is only stable for testing for 30 minutes. After completing the lab prep form for a suspected Ebola patient located in the Ebola binder, lab personnel should immediately contact the lab administrator to ask if the lab is ready to receive Ebola specimens.
May I speak to the lab admin on call, please?
Hello, this is Angie.
Hi, we just received notification that a lab specimen from a suspected Ebola patient are ready to be collected.
The lab administrator will then mobilize the correct staff to prepare the lab for possible Ebola testing and to collect the samples.
Hey, Angie. Hey. We have a potential Ebola patient in the hospital. Lynn, can you prepare the laboratory for incoming samples?
Yes, of course.
Anne-Marie, could you please go and get the sample?
Sure, on my way.
Is the lab ready to receive such specimen?
Yes, the laboratory is prepared.
Once the lab is ready to receive specimens, then lab personnel will inform the patient location the lab is ready and the specimens can be collected. Once assigned the task of picking up the samples, the lab technologist must go to Farley Room 817 to prepare the cooler for transport. With the transport cooler in hand, the assigned lab technologist will go to the patient room and pick up the samples in person.